his inspiration in all biomedical engineering. Through his AtheenaPandian Private Limited, which is a training academy. I would also like to take this moment to welcome our principal, Dr. G. Mehan Kumar, and our department, biomedical department HOD, Dr. Indu Nair, and to all the trainees and staff present here. And last but not least, I welcome my friends who made this festival possible and special. This workshop intends to resolve the practical hurdles posed by us during this difficult time. To conclude, I wish you all great success in your pursuits. Thank you.
Thank you, Priya. Leadership is about making others better as a result of your presence and making sure the impact lost in your absence. I would like to call upon our beloved principal, Dr. G. Mehan Kumar, who has been supporting and guiding many students and also been a supporting pillar of our college for 15 years. I request our principal sir to deliver a few words.
Good evening. Good evening. Dear Chief Guest, Dr. Atheena Pandian, founder of AtheenaPandian Private Limited, Dr. Indu Nair, HOD of Biomedical and Medical Electronics Departments, heads of various departments, faculty members, and my dear students. First of all, I regret for my absence yesterday after a very long time. Such an academic workshop is happening in the campus, creates positive vibe in the campus. That is started from Biomedical Engineering department. Makes me really happy. I congratulate all of you, students and faculty members, for this organization of a wonderful workshop for the benefit of you. Thank you. எல்லாத்துக்குமே பிடிச்சிருந்ததா workshop? Students? Right. I have read feedback from Dr. Pandian also. He said very optimistic about girl students and boy students. Why this difference? Girl students are very attentive comparatively with boys. This is what the feedback I received from Dr. In the past, and in this juncture, I would like to inform you another thing. Again, patting the department only. I think apart from the regular placement drives, biomedical students of 9 as a batch have been placed in this initial placement drive initiated by the college. So 9 members from biomedical departments have already placed. Congratulations to all. I expect all the final year students are to be placed. Our government is also supporting all of you. I have noticed the latest Anna University results. O grade அப்படின்றது வந்து எவ்வளவு சீக்கிரம் போச்சுல்ல, எல்லாருமே O grade. So I am not joking actually. You are really benefited. So academic marks அப்படின்ற criteria உங்க எல்லாத்துக்குமே ஹையா தான் இருக்கு. So eligibility for a placement drive is, as far as you students concerned, it is already there with you. Now your commitment, your aspiration to get a job, you have to make yourself ready. You have to go through the placement department. So purely you are responsible for your future. Please keep in mind. Right? You just follow the parts of the 9 students who are placed, whether the company is a very good company or an average company, whatever it is. Placement is placement, first initiation. ஒரு ஜாப்ல போயிட்டு அதுக்கப்புறம் நீங்க என்ன இருந்தாலும் வேறு வேலை வந்துடலாம். ரைட், இன்ஜினியர்ஸோட குவாலிட்டியே இருந்தால் we have to make everything, not only for our life but also every other things from a small footprint, from a small thing. Right? I wanted all my biomedical students, especially because நாம் அந்த காலேஜில் பயோமெடிக்கல் ஆரம்பிக்கும் போது பார்த்தீங்கன்னா ஒரு 2-3 காலேஜ் தான் கோயம்புத்தூரில் இருந்தது. நிறைய காலேஜஸ் நியர்பை கோயம்புத்தூர், ஈரோடு அந்த எல்லாம் பயோமெடிக்கல் அந்த 4 வருஷத்துக்கு முன்னாடி இல்லை. இன்னைக்கு நீங்கள் பார்த்தீங்கன்னா சாரும் நானும் பேசுவோம், அந்த மல்லசமுத்திரத்துலேருந்து ஆரம்பித்து இருக்கிற எல்லா காலேஜ்லையும் பயோமெடிக்கல் ஏஐ மாதிரி ஆர்டிஃபிஷியல் இன்டெலிஜென்ஸ் அண்ட் டேட்டா சயின்சஸ் அப்படின்னு சொல்லி 2 வருஷமாக தான் ஓடிட்டு இருக்கு. எங்கே போகிறாங்கன்னு தெரியல. Everything is relying on you guys, right? Subject எடுக்கிறதோ இன்னைக்கு ஃபீல்டு அப்படிதான் இருக்கு. இன்ஜினியரிங் ஃபீல்டு என்ன சப்ஜெக்ட் படிச்சிருக்கிறேன், மெக்கானிக்கல் டிபார்ட்மெண்ட் தான், கம்ப்யூட்டர் சயின்ஸ் டிபார்ட்மெண்ட் தான். So the jobs which are coming to your desk is irrelevant of your discipline. But biomedical is not like. Biomedical definitely you have to go as a core job வந்து நீங்க போக முடியும். ரைட், இப்போ வரிசையா எல்லா காலேஜ்லையும் பயோமெடிக்கல் இருக்கு. ஸோ ஹவு யூ ஆர் கோயிங் டு மேக் யுவர் செல்ஃப் டிஃபரெண்ட் ஃப்ரம் அதர்ஸ்? பிளேஸ்மெண்ட். நீங்க வெளியே போகிறதுக்கு முன்னாடி எல்லாருமே பிளேஸ் ஆகிருக்கிற மாதிரி பாருங்க. அந்த வேலை எல்லாமே hardly I find one professor to take the responsibility of placement cell. Mr. Denak is there. He will be definitely taking you to various companies. We have tie-ups and Dr. AtheenaPandian is also here. We have discussed. There are a lot of things to come from sir also. You have to grab things. Right? What is needed as a biomedical engineer outside the world? Know it. 2-3 colleges எல்லாமே பண்ணிட்டு இருக்காங்க. Your friends in that college, you can interact with them. Right? Get information about all those and make yourself eligible, fit to take up the job. Right? ஏன்னா காம்படிட்டிவ் வேர்ல்டு அப்படின்றதெல்லாம் நாங்கள் இருக்கும்போது ரொம்ப அதிகமாக இருந்தது. இப்போ வந்து வேலை ஈஸியாக கிடைக்குது. ஆனால் நம்ம பையன் என்ன சொல்கிறான், இந்த வேலையை போய் வேலை செய்யணும், மெக்கானிக்கல் போய்க்கணும். மெக்கானிக்கல்லாம் என்ன, டீசலு பெட்ரோல் எல்லாம் வேறு நிறைய இல்லை. அதுதான் பேசிக் மெக்கானிக்கல் இன்ஜினியரிங். அது வந்து ஐயோ நாங்கள் ஆட்டோமொபைல் இண்டஸ்ட்ரியிலாம் வேலை செய்யணும் சார், நாங்கள் ஏதாவது கேன் இண்டஸ்ட்ரி அந்த மாதிரி பார்க்கணும் நம்ம பசங்க. ஸோ ஆட்டிடியூட் மேட்டர்ஸ். ப்ளீஸ் மேனிபுலேட் யுவர் ஆட்டிடியூட் டுவர்ட்ஸ் பாசிட்டிவ் சைட். ரைட், இது வந்து மனசில் எப்பயுமே இருக்கும். நம்ம அப்பா அம்மா ஃபஸ்ட் இயரில் நம்மளை காலேஜில் கொண்டு வந்து சேர்த்துனது ஒரு நல்ல ஜாபுக்கு நம்ம பையனும் கொண்டு போய் ஜாயின் பண்ணணும் அப்படின்னு நினைக்கலாம். ரைட், யூ ஆர் பிரிங்கிங் டு த பாண்ட். உங்களை கூட்டிகிட்டு போய் விட்டுருக்காங்க, நாம் தான் எல்லாமே பண்ணிக்கணும். கிளியர்? ஸோ take the instructions from the college, from the placement cell. Placement cell is not no instruction mattum illa. So heavy instructions are from me, from CEO. Everything is for the benefit of you. There are pluses and minuses in the campus. Just leave it. Our life, we have to live. 1000 பிரச்சனைகள் இருந்தாலும் அதை தாண்டி உங்கள் லைஃப்பை நீங்கள் தான் செலக்ட் பண்ணணும். அதனால I hope the attentiveness in these 2 days shows your commitment. Congratulations to all. Definitely you will get. And as everyone is aware of, biomedical science, medical electronics, இந்த மாதிரி நியூ வேர்ட்ஸ் எல்லாம் இன்ஜினியரிங் பிரான்ச்சஸில் வந்திருக்கு. முன்ன பார்த்தீங்கன்னா ஈவன் இன் மெடிக்கல் ஃபீல்ட் there are some subjects which are focusing on instrumentation etc. Otherwise in engineering, electronics and instrumentation takes care of all the biomedical equipment manufacturing etc. But nowadays it is a separate branch. Everything is in your hand and your challenges are electronics and instrumentation also. So you have to make yourself very clear that we are better than any other branches. அதனால நிறைய படிக்கணும். உங்களோட பேசிக் சப்ஜெக்ட்ஸில் நாலேஜ் இருக்கணும். ஆல்வேஸ் பேசிக்ஸ் மேட்டர்ஸ். ரொம்ப எலக்டிவ்ல எல்லாம் நீங்கள் பெரிய சித்தா இருக்கணுன்ற அவசியம்லாம் கிடையாது. ஒரு இன்டர்வியூக்கு போகிறீங்க அப்படின்னா என்ன எலக்டிவ் பார்த்தேன் படித்தேன் அதை பற்றி சொல்லணும்னு யாரும் கேட்க மாட்டாங்க. வாட் இஸ் த பேசிக்ஸ்? உங்களுக்கு பயோமெடிக்கலுக்கு ஒரு பேசிக் சப்ஜெக்ட்ஸ் இருக்கும். இந்த பேசிக் சப்ஜெக்ட்ஸில் பி வெரி ஸ்ட்ராங். Whatever be the exam you are looking into, not only your biomedical exams but also எந்த எக்ஸாம் போனாலும் பேசிக்ஸ் தான் ஸ்ட்ராங்காக இருக்கணும். அதனால் be very strong in your basics, right? And since lot of engineering colleges started biomedical engineering, after UG you have another field, teaching line is also awaiting for everyone. We are managing the departments with faculty from electronics and communication, instrumentation, etc. etc. But when all these engineers are coming out, you do your PG also, a lot of opportunities are there, right? Be brisk, be positive attitude. எந்த ப்ராப்ளம் இருந்தாலும் சரி நம்ம லைஃப்ல இருக்கும்போது மனசு ஃபுல்லாக பாசிட்டிவாக இருக்கும், ஈஸியாக ஜெயிச்சிடும். கிளியர்? ஏன்னா புது பிரான்ச்சு, அடுத்தது ஜியோ இன்ஃபர்மேட்டிக்ஸ் இருக்குது, புது பிரான்ச்சு. அதனால again and again I wish every one of you to have a great future and great placements. இந்த ஒவ்வொரு ஒர்க் ஷாப்பும் அது உங்களுக்கு வந்து நிறைய ஹெல்ப்ஃபுல்லாக இருக்கும்னு நினைக்கிறேன். ஏன்னா சார் வந்து டீச் பண்ணுறது எல்லாமே பேசிக்ஸில் ஸ்ட்ராங்காக தான் உங்களுக்கு சொல்கிறாங்க. ஸோ வாட் எவர் he proposes in the lab or classes, everything is helpful for you, whatever we discussed so far in those areas. And other than that, even good students who are able to get good marks, there are a lot of chances for you since the number of colleges providing biomedical, even though many colleges are offering biomedical engineering, but as of now, for final year, number of colleges offering biomedical engineering is limited. So there are a lot of scopes for bright students who are having consistently good score to get gold medal in the university exam. அதையும் பாருங்க, ரைட்? எல்லாமே உங்கள் கையில் தான். So I think you will take up all these in mind and you will come out with flying colors. I wish every one of you a grand success in the days to come. And projects also, take up your projects so that it will also helpful in many ways, right? Madam and other faculty members, senior members in electronics and communication engineering, you can have contact and discuss with them also. So with this, I once again congratulate the department, particularly Dr. Atheena, who is a single lady. Really great. We have to appreciate and congratulate her because the department staff, நிறைய ஸ்டாஃப் இருக்காங்க. எலக்ட்ரானிக்ஸே பயோமெடிக்கல் ஹெல்ப் பண்ணுறது. ஈவன் தட் இஸ் த கேஸ், அந்த டிபார்ட்மெண்ட்டில் இருக்கிற பிரைட் ஸ்டாஃப் அதுலேயும் அவங்க தான் எல்லாத்தையும் பண்ணியிருக்காங்கன்னு இன்ஃபார்ம். ஸோ கங்க்ராச்சுலேஷன்ஸ். All the students, without your support, I think she could not, it's not possible. It's not magic and it's not everything is made by you, manipulated by you, and I congratulate all the students who are involved in it. And above all, I thank Dr. Pandian sir who accepted to come, even though he is having a list of colleges to conduct the same program. He gave preference to our college and came here and give positive to all of you. Thanks sir for coming. All the best. All the best to one another. Thank you.
Thank you, sir. I hope biophysics has added a few memories to your life. We would like to know how well have our efforts benefited to you. I request anyone among the participants to give us feedback on the fest.
Myself, Rajeshwari from final year Biomedical Engineering. So today's experience is very good as I learned hands-on training on biomedical equipment. It's a wonderful experience to learn the things that I have learned, that is practically, not theoretically. Today I have seen defibrillator, suction pump, infusion pump. Like that, practically I have seen it and I have dismantled it. It's a hands-on training. Thank you for this wonderful experience. Thank you for HOD ma'am and Pradeep sir and principal sir for this wonderful opportunity.
Good evening. Today, principal session full positivity break. Afternoon, morning afternoon total class. So, we last finish test class number accurate so application dismantle SMPS நம்ம அதை எக்ஸ்பெரிமெண்ட் பண்ணி நம்ம நேராக பார்க்கும்போது தான் தெரியுது அதை ஒட்டிங் இதுக்காக பண்ணுறோம் அப்படின்ற மாதிரி தெரியுது. இந்த மாதிரி நம்ம நேராக எக்ஸ்பெரிமெண்ட் பண்ணி காட்டும்போது கொஞ்சம் சிம்பிளாக எல்லாருமே ஈஸியாக புரியுற மாதிரி விஷயமா இருக்குது. ஸோ நீங்கள் ஃபுல்லாகவே எக்ஸ்ட்ராக டேவாக போச்சு. ஃபுல் பாசிட்டிவ். தேங்க்யூ.
Hereby I am Sir from second year medical transport. Very warm evening to all of you. First of all, inauguration function நடந்துச்சு நம்ம அசோசியேஷனோட. அது நீங்க எல்லாம் பாசிட்டிவா இருக்காது. ஃபர்ஸ்ட் அதுக்கு தேங்க்ஸ் சொல்லிக்கிறேன். இன்னைக்கு செஷன் எப்படின்னா ரொம்ப இன்டராக்டிவா இருந்தது. மார்னிங் செஷனால சொல்லவே தெரியல. நம்ம குகன் சார் சார் நீங்க ரொம்ப இன்டராக்டிவா நடத்துறீங்க சார். காலையில இன்டராக்டிவான செஷன் சார். நான் ரொம்ப என்ஜாய் பண்ணேன். மார்னிங் சார் வந்து எனக்கு ECG அதை பத்தி நடத்தினாரு. அது ரொம்ப இன்ட்ரெஸ்டிங்கா இருந்தது. அவ்வளோ இன்ட்ரெஸ்டிங்கா நடத்தினாங்க. அதுக்கப்புறம் லாஸ்ட் இந்த டெஸ்ட் வந்து கண்டக்ட் பண்ணாங்க. நம்ம ஃப்ரெண்ட்ஸ் பத்தி தான் தெரியுமே. நம்ம எப்படி டெஸ்ட் பண்ணா எதுக்கு இத்தனை பண்ணோம். அந்த மாதிரி நாங்கள் கொஞ்சம் இது பண்ணா எங்களோட மனசாட்சி பிலீவ் பண்ணி தான் நாங்கள் இருக்கணும் டெஸ்ட் எல்லாம். இந்த செஷன் ரொம்ப நல்லது. எங்களுக்கு ப்ராக்டிக்கல் நாலேஜ் நல்லது. தேங்க்யூ.
Thank you. The man who integrates nature is always built in great honor. Mr. AtheenaPandian, founder and managing director of AtheenaPandian Private Limited, has total teaching experience of 10 years and about 5 years of industrial experience. AtheenaPandian Private Limited has been awarded Emerging Company by Indian Achievers Award. He has published Biomed books through the International Notion at Amazon Publishers. Now I request the Chief Guest to deliver the most awaited speech.
So thank God first of all. Thank you to the management of Park Institutions. Thank you to the respected principal sir, respected staff department, other faculty members, and my dear friends. So first of all, principal sir said some of the most important thing what you actually required by each and every biomedical engineers. The three important basic things actually required in the market. One is responsibility, another one is skill, another one is experience. So these three important things, basic things for competitive you among the biomedical engineers who are all from various colleges. So as principals have said, 5 years back or 5 to 6 years back, the count of biomedical engineering colleges is around 21. For the past 2 years, the count of biomedical engineering colleges is 89. Just think about it. The people, those who are finish their biomedical engineering and get to compete with you, the count of members is around 4,500 members. Around 4,500 members, you are going to compete with them and to get a place with some other good companies. In the inaugural lecture, I said the jobs are waiting for you because healthcare requirement is heavier nowadays. Each and everybody is requiring some healthcare support. For that, the healthcare equipments are keep on developing. Almost 29,000 biomedical equipments are there still now. So for the past 2 years now, the enormous amount of biomedical equipment will be approved by so many accreditations, of course, in annual I said. So the vacancies in the biomedical companies is much heavier. But which is the place you are going to face? That is most important. That is what, as per the colleges come, as a final year and during the third year itself, you should know about the biomedical companies also. Sure, all the biomedical companies they are requiring, sure, all the biomedical job scopes are available. What is the market? What is the reason why I am saying this? What is the reason why we are knowing about the market in the third year itself? Means that we have a YouTube channel and we have some of the research among the freshers in the 1920 period. In the 2019-20 period, we have some of the interviews, some of the freshers, we got some of the news that 1,195 plus students are get placed in the Tier 1 companies. 1,195 students are get placed in the Tier 1 company as a fresher. But one sad thing is that among that particular 1,195 students, 55 to 65% of the students are get resigned their job in 3 months. They resign the job in 3 months. That is very short. They are getting a salary of around 30,000 or 35,000 2 to 3 years back. What is the reason why they are resigning the job means that they doesn't know the market. Because the market of biomedical engineering is entirely different from the department what you are expecting there in the market. Because, of course, in the biomedical engineering, we have almost 16 biomedical job scopes are there. We can able to say something about biomedical sales engineer, biomedical service engineer, biomedical application engineer, hospital biomedical engineer, clinical engineer, biomedical researcher, biomedical consultant, biomedical signal analyst, biomedical data analyst, biomedical image analyst, biomedical researcher. Like that, over 16 biomedical job scopes are there. If you are chosen correctly only, you can able to keep on going on that particular job. For example, you are well in electronics. You can able to troubleshoot at any sort of the equipment's troubles. But fortunately or unfortunately, you are supposed to place in a sales biomedical engineer. You just feel that I know electronics, but there is no chance to speak about electronics. In front of the doctors, I want to speak something. I don't have any communication. But instead of that, you are just placed in that period. And then within 3 months or within 4 months, you are just resigning the job. So that is what, my dear students, I My kind advice is that during the third year itself, you must know about the biomedical job scopes. You must know about which are all the companies are in the position tier 1. In the 2000, another statistics I can able to say, in the 2021, the count of tier 1 companies is 21. In the 22, the count of biomedical companies, the tier 1 biomedical companies is around 25. The tier 2 companies count is around 90 plus. The tier 3 companies is around 140 plus and tier 4 companies is around 400 plus. The tier 4 biomedical companies are also considered as biomedical job only. They are also providing biomedical job only. But the thing is, how we can able to choose the tier 1, tier 2, tier 3, tier 4 means that according to your practical knowledge. What I said, the responsibilities, skills and experience. These are all the basic scenarios each and every biomedical engineer should require. Responsibilities means that you know very well about all the biomedical job scopes. That is your responsibility. Skills. What is an exact skill required for the responsibility? When you are appointed as a sales biomedical engineer, what are the skills required? You should know. If you are appointed as a biomedical researcher, you should know what are the skills required. All these things you can able to know about from your seniors or from the faculties or from other company peoples, whomever it may be. Once you got all these things, use that particular intelligence, you just use your experience. Experience is not belongs to the market study. The experience is totally belongs to your department. The experience is not means that as you are as a faculty, 1 year, 2 year experience, 3 year experience, 4 year experience. Experience means that when the biomedical is concerned, experience is nothing but how much amount of time you are spending to handling the equipment. That kind of experience the company is expecting. How much amount of time you are spending to troubleshooting the defibrillator machine, the X-ray machine, the CT scan machine, the MRI scan machine. That kind of experience they are actually counting. How much time you have spent that, how much troubles you can able to shoot, and how much doctors you can able to connect, and how much hospitals you can able to connect, and which are all the areas you are good. All the things you can able to learn in this 4 sort of period, 4 years of period. Because that is what the most important scenario in the market is happening. Because as I said, so as I said, no, in the interview, in a biomedical interview is concerned, they are not going to ask what is X-ray. They are not going to ask what is the principle of X-ray. They are not going to ask what is Kirchhoff's law. They are not going to ask what is Ohm's law. They are going to ask entirely different. Why the motors are used in this particular equipment? Why the transformers are used in X-ray? Why this particular Kirchhoff's law is applied over in this particular section bomb? What is the negative pressure going over it? These are all things not available in academic book. Keep on, we are following the same book Kanpur for the past 15 years. Past 15 years we are following the same book Kanpur, but in that Kanpur now there are only 100 plus equipments are there in the kind, but now we have currently 29,000 biomedical equipments are there. If you keep on studying through the book, you can able to know only 100 plus. But remaining thing, how we can able to learn? You just come out and learn about the market during the period, during the vacation period. You need to go out and see some of the hospital and what is the equipment over there, and which are all the equipments need to troubleshoot more, which are all the trending equipment we need to follow, and we are just follow something what is happening in the market clearly, because each and every day the healthcare market is growing. So during that period, if you want to compete with other competitors, you must be think different, you must be different. If you want to resume, if your resume should be shortlisted, that resume should be inspired. Then only they can able to call for. For example, once you have a guts to put instead of resume or curriculum vitae, instead of that you just put a heading as ultrasound specialist. I am an X-ray specialist. I am an ECG specialist. If you have a guts to put over there in the resume, then that makes inspired answer. What is happening? This particular boy is currently doing the final year. Then he is boldly said he is an ultrasound specialist. How we can able to create? How we can able to get during the final year or during the stage year? You just keep on concentrating to learn about at least 10 to 15 equipments knock and corner. Then you can able to get guts and put it in the resume itself. I am an ultrasound specialist. That would be inspired. Then interviewer call you. Then ask about something about why you are putting ultrasound specialist. Sir, I very well know about ultrasound. That is what I just did. Then they throw the questions, 100 plus questions they throw. You can able to answer it because you are spend the time, lot of time with ultrasound machine. Then you can able to answer whatever the question he may ask. So that is what actually the market people is expecting. That is what the market, because recently we sent almost 16 people to Akash Infusions. In Akash Infusions production engineering, they were asked these kind of questions. So that is what, my dear guys, they are expecting entirely different. Don't fluctuate on your decisions, and also your market also easier understanding. Healthcare market is little bit of, I'm not scaring you now, but it is an alert message for you to compete. So many competitors, they are coming with you, and because so many startup companies are there, 400 plus tier 4 companies are there in India. No? In that, around 15 to 25% of the companies are in Biomedical. All they are manufacturing respiratory equipments because of the COVID. He is actually studying he is studying electronics and communication. He started investing the money to manufacturing oxygen concentrator machine. Because the market is like that. The market is like that. Healthcare market is keep on going. Some of the people, they are investing money over there in some other areas. They start investing the money towards the healthcare manufacturing products. So that is what the competition is heavier. So keep concentrating on your studies and keep concentrating to know about the market, very important. You are keep on studying the books, keep on studying through the practical knowledge is not only important, at least 10 to 15% you should know about the market, what is happening, and then only you can able to ready yourselves among the competitors. So thank you very much for this opportunity to give, to share my few words to the young biomedical engineers. Thanks to the patients, to all the respected people over there in the dais and all the dais. Thank you very much, and thank God once again.
It doesn't matter what's been written in your story so far. It's how you fill up the rest of the pages that counts. I request Dr. Rajendra Prasad, HOD of Textile Department, to deliver guest of honor.
Distinguished guest of this program, Dr. Atheena Pandian, beloved principal, Dr. G. Mohan, and head of the Biomedical Department, Dr. Atheena, fellow faculty members, and my dear students. Good evening to all. Okay, thank you. I think all of you enjoyed these today's event. We had some training and got a lot of insights and take-home points. So during the inaugural session, I had a brief talk with Dr. AtheenaPandian. So he shared his business model and so what is the future and all. So he was so keen to interact with you guys, and he was so passionate and interactive. So you are lucky enough to have such a personality for this occasion. Very sincere appreciation to Dr. Pandian. And so I would like to share some of my thoughts about this emerging field of study biomedical engineering and medical electronics. This is unlike your other engineering studies. As also it's totally different. So you are going to play a pivotal role. So you are going to handle a life-saving device. Okay. Unlike a machine, you can do some maintenance and do some fixing the problem. It's not an issue. But if an instrument fails, a life-saving device or life-saving equipment fails, it's not only damage to the machine, it's catastrophic and it is fatal.
you are playing with human life. So, such an important area. So, we are going to work with this type of equipments and devices. Not only that, there are not more. Then, say for example, the emerging areas. Look at these emerging areas. I'm not an expert in the biomedical engineering or anything, but I know something about this healthcare sector and hygiene sector. Okay. So, for example, there are rapid advances, technologies advancing so rapidly. Say, for example, say the non-invasive technologies. Non-invasive technologies. So, for treatment. And you have performing some surgeries remotely. Okay, a surgeon from US can operate a patient in India. So the technologies are so advanced, and you have to equip yourself to meet these challenges. Okay, so not only that, there are so many other segments. For example, I think you might have come across as sort of during the COVID pandemic. So there was a huge demand for these ventilators or respirators. I think many of the people lost their life. So immediately some companies, so they deployed or realized, and they started manufacturing these devices to save the lives, thousands of lives. Okay, so these are some of the importance of your role as an engineer. Okay. So the next thing, I am also a biomedical engineer. So why? Okay. See, there is a segment in textile technology, there is a segment or sector called medical textiles. So this is another segment or niche segment, so which caters to the healthcare and hygiene sector. Okay. For example, so we have textile devices, textile substrates, fabrics, yarn. So these materials, textile materials, are used for different applications. For example, you take some implantable devices, some implantable materials. Say for example, your cardiovascular grafts. For this vascular graft surgery, we are going for an artificial graft, vascular graft. So that is made up of textiles. So the tubular structure. Okay, so this artificial graft, it is a knitted tube made of polyester. Okay, so this type of small devices, textile devices, are implantable applications. Not only that. So you have products like hernia mesh. So for the hernia surgery and hernia mesh. So it is a structure, knitted structure made of some synthetic element. So that is used for artificially replacing your hernia. So not only that, you have artificial ligaments. So artificial ligaments, knee ligaments and tendons. So these ligaments are made up of carbon fiber. So these are materials. So precisely designed and approved by agencies like FDA. Okay, so the test you should pass the test international standards when you go for a medical device, whether it's a textile material or any equipment. Okay, so these are some of the applications. Not only that, so you have other extracorporeal devices. So these are the devices, say for example your dialyzer. So where you use a textile filter for filtering the blood. So for filtering your blood to remove all the impurities or any contaminants. Okay, so the dialyzer uses a textile material. So like with sutures, so for any cut injury, so you are using sutures. It is made up of textile filament, textile yarn or silk thread or cellulose material. Okay, so not only that, you have wound care products. You have a lot of international brands, Johnson. So many products in wound care. So nowadays, so the wound care products are so advanced. So there is a concept called martial environment wound dressing, wound management. So mainly for curing the chronic disease, chronic wounds. So there is a controlled drug release in the textile material, so that releases the drug at a controlled rate, so that it prevents the infection and any microbial contamination. So this is how the textile materials are playing, so many applications. And another area, so if you look at a surgeon, you could have seen that he has a mask, mask head, and the surgical gowns, gloves, all those things. So these are textile materials, specially designed, for surgical procedures. So these materials are blood-proof for any pathogenic protection, microbes protection. So these type of surgical goods are specially designed, with antimicrobial properties, antiviral properties, blood resistance, and resistance to body fluids. And another area you have smart garments, or wearable electronics. You have some embedded electronics in the garments, so the surgeon or the physician can monitor the patient remotely. So where you have all the electronics in your garment. So you can communicate using your mobile or anything. So these are some of the technologies emerging in this medical textile. And also you have other for varicose vein. So this is a chronic disease. So I think one institute, IIT Delhi, so they set up a exclusive medical textile lab, and they have all facilities. So to design a compression garments. So it is like a stocking, so you can wear it on your leg. So especially designed depending on the profile of your leg. So that will regulate your blood flow to recover from this varicose vein. So these are some of the applications of textiles in the medical field or health and hygienic field. And also you have hygienic applications like white diapers and incontinence pads and so many other things. Wipes, so many more. So these are a lot of scopes, and also sensors, textile sensors, textrodes, all textrodes, so connected fabrics. So it's for gel. So for ECG, we are using gel. So nowadays, so people started doing research to use it by replace it by conductive fabric. So instead of using conductive gel, you can use a textile sensor. So a lot of work is going on, research work is going on. So to meet out all these type of challenges. So I think you students have to keep abreast of the new technologies. So because you want to become employable, so you have to have the unique knowledge, and hands-on experience, all those things. So, and the government is also, the Indian government is also coming with a lot of schemes. For example, startups and Make in India schemes and other subsidized schemes. So there are so many things. So make use of this opportunity, and there are a lot of unexplored areas unexplored. Yes, there are a lot of equipments, there are still areas unexplored. Let's make an attempt, to make indigenous technologies. So there are a lot of scopes on you guys. I wish you all the best. Thank you for this opportunity.
Giving up and letting go are not the same thing. One says you are not worthy of the prize, the other says you are the prize. I request our chief guest along with our principal and lecturing man to distribute the certificates. I request class representative of final year Biomedical Engineering to represent everyone and receive the certificates. I request class representative of second year biomedical engineering to represent everyone and receive the certificates. I request class representative of second year medical electronics to represent everyone and receive the certificates. Thank you, sir. Thank you, ma'am. As a token of gratitude and honor, I now request lecturing ma'am, Dr. Indu Nair, to present the memento to their principal. Thank you, ma'am. I request the principal, sir, to present a token of gratitude to the chief guest. Thank you, sir. I request the lecturer ma'am to present the token of gratitude to the trainers. Google prayer. Rashida ma'am, Venina ma'am, Ilitya ma'am, Diana ma'am. Thank you, ma'am. Thank you, sir. Balloon. Balloons of all goodness lie in the soil and
Good evening, everybody. Honorable Chief Guest Dr. Atheena Pandian, sir, Available Principal Dr. G. Mohan Kumar, faculty members, and my dear students. First of all, I would like to extend a warm welcome, very thankful to Dr. G. Mohan Kumar, sir, our beloved principal, for all the support, for all the encouragement, and extended towards us. And I would like to extend our sincere thanks and gratitude to the chief guest, Dr. AtheenaPandian, sir, and the team for giving us an extensive coverage on this topic. And thank you all for all the faculty members for all the help extended towards the Biomedical Engineering department. I'll be filling in my duty if I don't encourage my students, and I'm happy that our students have done a great job and making this function a grand success. Thank you.
I request